Stomach aches or abdominal pain can arise from various causes, ranging from benign to serious conditions. Understanding the underlying causes, symptoms, and potential treatments is essential for both nursing practice and patient education. Gastrointestinal disorders, gastritis, inflammation of the stomach lining, peptic ulcer disease, sores on the stomach or duodenum lining. Gastroenteritis, inflammation of the stomach and intestines, often due to infection. Irritable bowel syndrome or IBS, a functional gastrointestinal disorder causing pain, bloating, and changes in bowel habits. Constipation. Hard, infrequent stools leading to discomfort. Non-gastrointestinal causes. Appendicitis, inflammation of the appendix, often requiring surgical intervention. Gallstones, solid particles that form in the gallbladder, leading to pain, especially after eating fatty meals. Pancreatitis, inflammation of the pancreas, often associated with alcohol use or gallstones. Kidney stones, hard mineral deposits that can cause severe pain when passing through the urinary tract. Other causes: food intolerances or allergies. Reactions to certain foods can cause abdominal pain, stress, and anxiety. Psychological factors can manifest as physical symptoms: menstrual cramps, pain associated with the menstrual cycle. Symptoms associated with stomach aches: cramping or sharp pain, bloating, nausea or vomiting, diarrhea or constipation, fever if infection is present, changes in appetite. Diagnostic evaluation involves several steps. First, a physical examination is conducted, assessing tenderness, distension, and bowel sounds. Then laboratory tests, such as blood tests, urinalysis, and stool tests, are performed to identify infections or other issues. Lastly, imaging studies like ultrasound, kinetic scans, or X-rays are used to visualize abdominal organs. When it comes to medications, there are a few options. Antacids or proton pump inhibitors are used for acid-related issues. Antispasmodics help with cramping. If a bacterial infection is diagnosed, antibiotics are prescribed. And for constipation, laxatives can be effective. Lifestyle modifications can significantly improve symptoms. These include dietary changes, increased hydration, and stress management techniques. In some cases, surgery is necessary, such as for conditions like appendicitis or severe gallbladder disease. All right, let's dive into the first question. A nurse is assessing a client who reports abdominal pain and has a history of peptic ulcer disease. Which of the following findings would be most concerning? Is it A. Pain that worsens after eating, B. Pain relieved by eating, C. Presence of black tarry stools, D. Mild tenderness in the upper abdomen? And now for the answer. The correct choice is C. Presence of black tarry stools. The rationale behind this is that black tarry stools, also known as melena, indicate the presence of digested blood, which may suggest a bleeding ulcer. This finding is concerning and requires immediate medical attention. The other options are consistent with peptic ulcer disease but are not as urgent. Question 2. A client presents with severe abdominal pain, fever, and nausea. The nurse suspects appendicitis. Which of the following assessments is most important prior to surgery? A. Assessing bowel sounds. B. Palpating the abdomen for tenderness. C. Checking for rebound tenderness in the right lower quadrant. D. Monitoring the client's vital signs. Answer D. Monitoring the client's vital signs. Rationale. Vital signs are critical to assess for signs of infection or sepsis, especially before surgery. While the other assessments are important in evaluating appendicitis, changes in vital signs can indicate the need for immediate intervention. Question 3. A client diagnosed with irritable bowel syndrome, or IBS, is being discharged with dietary recommendations. Which statement by the client indicates a need for further teaching? A. I should keep a food diary to identify triggers. B. I can eat high-fat foods as they won't affect my IBS. C. I will increase my fiber intake gradually. D. I should drink plenty of fluids. Answer B. I can eat high-fat foods as they won't affect my IBS. Rationale. High-fat foods can exacerbate symptoms of IBS for many patients. The other statements reflect appropriate management strategies for IBS, including monitoring food intake and increasing fiber and hydration.